I was thinking about this the other day as someone who values my time a lot, and I want to get into a position where my time is also valued by other people, which is important to me. I was thinking there's actually no point being awkward with anything. I just kind of had this revelation that, in the sense that every time I've been awkward in my life, I eventually become not awkward, and that whole time of being awkward is just a waste of time.
I don't know how to debate that, I guess. So I tend to agree. I find that overall, just awkward situations don't really produce any good outcomes from
Yeah,
that conversation or instance in general. Um, I'm not awkward in most conversations or most situations with people one on one. But if you put me in front of a group setting, then it's like, oh, okay, stress is on because I've got to perform not just for one person in a conversation, but perform for multiple people for an entire room, keep all of their attention, which is extremely difficult now with our shortened attention span thanks to TikTok and Instagram. But I agree with you. I think that's a pretty appropriate response. But
yeah.
but realistically, what is the downside of being awkward in a conversation?
I guess for me, I just see it as that I just see it as wasting my time. As someone who I really care about my time and I care about using my time effectively. And if you want to be someone whose time is valuable and time actually means something, which I think that's a fair enough thing to aspire to, then you should start with looking at yourself and looking at what areas am I wasting in my life? What facets in my life am I wasting my time? And for me, that was being awkward in situations that I didn't need to be awkward in, being awkward at work or being awkward doing whatever it is. And then, you know, a week later or 2 weeks later, I'm not awkward anymore. And it's kind of just like what was I doing for that week or 2 weeks? I was just wasting my time. That's essentially what I felt like.
Define awkward as in like it's a cringe conversation, you feel self-conscious, or it's like the whole conversation is awkward in the environment and it's kind of just
Both.
kind of beating around the
Yeah.
bush.
Yeah, probably both. Yeah. Yeah. And then if I had have just been able to let that go, I would have been able to would have been able to get better at it quicker. I would have been able to do a much better job then. I feel like it's only detriments to my life that being awkward creates. And if there was some sort of an advantage of it, and that, it makes you better in the long run, but it just doesn't. It literally just holds you back. And then until I got comfortable enough to a position where I wasn't awkward anymore, then I could actually start getting better. But I needed to get over that first hurdle first. And I think if there's a way to just remove that first hurdle of awkwardness in general, it's just only going to lead to better outcomes.
I think there's a common thing that you can quite relate to as well as I can, I guess. A lot of dietitians have imposter syndrome in the sense that once they graduate, it's like, okay, cool, I've spent 5 years studying how to learn and apply nutrition, medical nutrition therapy to clientele, patients, participants, whatever you want to call the individuals that we're applying it to. How do I actually do that? And then going out into that real world environment of applying that to a real person rather than a textbook can be quite confronting, especially when nobody's holding your hand, there's no supervisor around, making sure that you do everything right, ticking all the boxes. I would liken that to the sense of being awkward in general because it does feel like an awkward experience. The person in front of you has absolutely no idea the difference between you versus an experienced individual. They've probably never seen a dietitian before in their life, but you can
Mm.
tell the difference personally. I think getting over that initial hurdle of, okay, establishing what I do know, what I don't know. And I think being honest about the entire situation is incredibly important because I think if you're lying to the client about things you know or lying to yourself about things you know, I think you get down a very slippery slope. Like I
Mm.
recently had, not recently, it was a fair few many years ago, I had a friend of mine ask me, why is it bad to eat close to dinner time, like close to sleep time? I'm like, I don't think it is, but like I can't really explain why.
Mm.
And of course, I spent 2 minutes thinking about it later on. I'm like, okay, I can list off 10 reasons why it doesn't really matter, unless, of course, it's influencing your sleep quality, and then it's a whole different ball bag. But
Mm.
I think just being honest about the entire situation. Okay, here's what I do know. Here's what I don't know. Here's the conclusion that we can come to right now. But if you give me half a day, you give me 24 hours, I can come back to you with a whole list of information of why I think a certain way, the evidence supporting it, and how we can go from that position. I think you can apply that to many aspects of life in general. Of even if you're doing something like I used to work for a supermarket chain cleaning the floors. you can definitely tell what people know how to do and what people don't just from looking around in terms of everyone else doing their job, and the people who are unable to or afraid to speak up and ask for help often get stuck in that position of never being able to improve. Is that kind of
Yeah,
something you were alluding to?
I think, yeah, because I used to be very black and white about, oh, it's just all ego. You know, if someone is not willing to admit that they don't know how to do something or acknowledge that, I used to say, oh, it all just comes down to ego, because you should be confident enough to just admit that you don't know. But I think it's only ego when you're in a position of authority. Other times, I feel like there can be exceptions made. And what I mean by that is that if you're in a position of authority over someone, and, I'm sure that the way Matthew and I like to hold our consultations with clients is that it's very, very collaborative, very, we're working together as a team to improve this person's life. But there still is, the reality is they still have come to us, and there is just an inherent position of authority over it, no matter how much we try to break down those walls and those barriers. Would you agree with that overall, Matt?
Yeah, I would definitely say
Yeah.
so. I think there's very few cases where it's been like, okay, you clearly know a lot of information. Now it's more of a conversation in terms of two different health-oriented individuals. But then for majority of cases, it's a position of, okay, I'm meant to know everything with nutrition. I think it's important to establish what I do and I don't. And then, of course, continuing with your point.
Yeah. So essentially, the reality is, just, despite us trying to remove that authority element of it, we do have some sort of authority, and it takes confidence and takes, you have a good understanding of the things you do know and that you don't know, to admit that you don't know something. And because it is a bit scary, and it is a bit, especially when you're meant to be the person of authority, you're meant to know everything. It is a little bit scary for people, especially if you feel insecure about your knowledge, especially if you feel insecure about your knowledge and nutrition overall, to admit you don't know something. So that definitely comes down to ego. But I think for me, what I've experienced in the workforce as well is that when you're in a position of the opposite of authority, whatever, I don't even know what that is, and you kind of need to fake it till you make it, right? You don't know things, but you kind of just got to fake it there, because if you keep saying over and over again, I don't know this, I don't know that, I don't know how to do this, then there is that element of that they just think that there's that fear that they just think you're incompetent. And unfortunately, the realities of a workforce is that if you keep saying, if someone's employing you and you keep saying you don't know, and you keep bugging them and annoying them, they're going to choose someone who isn't doing that and is just going to make calls for themselves and essentially make it up on the spot and fake it till they make it and stumble through the hurdles themselves, so they're not annoying the employer. Does that, do you agree with that on the whole, as well as what my experience has been personally?
I do and I don't. I think that the current let's say, area of multiple layers of chain of command often caters for people just looking for a yes man. CEO wants this done. Yes, boss, no problem.
Mm-hmm.
That manager wants that manager to do that. Yes, boss, no problem. That manager wants the normal worklings to do whatever the thing is. Yes, boss, no problem. As long as people say yes and they give it a shot and it doesn't get done, it's like, okay, well, we've attempted it. Washing my hands, it's the person under me is problem. Like, I've got to, of course, you have certain things to uphold and you've got a duty to do something, but as long as the idea of yes and I can do it and I'll get it done is kind of upheld, then I think everything just flows relatively easily from a chain of command perspective. Does it mean that we're actually producing a quantifiable outcome that is better than a situation of I don't know? I don't think so. I think it's the exact same scenario. It's just one is more comfortable and less annoying for chain of command.
Yeah, for sure. But then they wouldn't hire someone that kept saying, I don't know, right? Like, if you got two options, like even with us, like I'd be happy to admit if we had someone that we were putting on at our team that kept saying, I don't know, over and like for months and months and months, it'd be like, man, come on, like, are you going to get it? Like, you're going to do it on your own? But if we had someone that was like, look, that pretended that they actually knew or they didn't know, and they stumbled through it and they kind of figured it out, I'd much rather hire the person that pretended.
Well, I guess it really does depend on that exact scenario. So I quite like the phrase, I don't know. And I use that very importantly. I use it carefully as well. There are specific times where I will express I'm not sure, but I think just leaving it at that is a massive problem. you're not going to get anywhere from that. You're just looking out for a helping hand to guide you through that situation. But if you say, I don't know, but here's what I would do, here's what I'm going to do, here's how I'm going to get around the situation. And then, of course, if you need additional help, having the I don't know is appropriate, of course. So if I'm having a conversation with, let's say, a client who I've never seen their medical condition before, as in like I've never had someone, let's use type 2 diabetes, for example. For context, I see type 2 diabetes very, very commonly. But let's say I've never seen someone with type 2 diabetes before. I have no idea what glycemic index is, no idea what a carbohydrate is, or spatial timing, or fiber, or protein, or anything like that. I should be in a position to say, I don't know. If you say, I do know, I would say that's way out of your scope of practice.
Oh, for
that's
sure.
malpractice in a sense. Definitely is, actually. And that's very inappropriate for that specific situation. But you say, hey, I don't know, can you, the boss or whatever, or some support network, can you quickly teach me how I would actually go through this kind of conversation? And then you can make the decision of, am I appropriate to have this consultation with this individual? And can I continue going forward with that? But I find a lot of people, I wouldn't say so much in qualified health practitioners, but I would say a lot of people in general would be thinking, I don't really know how to do this, but I have to do it because it's my job. It's kind of like, I'll just stumble through it.
Yeah, I think when you're dealing with people, and especially people's health, it was probably more accepted. But I'd say in spheres where you're not doing that, and it's more, if a boss comes to you and it's like, hey, can you whip up this Excel document? I really need this spreadsheet done by X amount of time. And you've never used Excel in your life. If you've got two people that never used Excel in their life, and one of them goes, sorry, boss, I've got no idea how to do that. And one of them goes, yep. And they go, fuck, I'm going to need to get on YouTube and figure this out real quick. That, like, I guess that, like, that's what I kind of mean. You know what I mean? Like, in that it's okay to just say, yes, I know how to do it, and stumble through it for people who are under the authority.
It sounds like you've got 4 different blocks there. So you've got the yes, can do it. Yes, don't know, but we'll figure it out. No, can't do it. Don't know, but can figure it out. It's almost like we're selecting you're kind of choosing the two where it's very much a don't know, but can figure it out, versus don't know and don't know how to do it.
Yeah, I think for me, well, obviously, if anyone says no, I don't know, that's just a dumb response. You know what I mean? Like if someone asks you to do something and you say nah, soz, that's obviously dumb. So that's out of the question.
Yeah.
I think for me, the element of saying, look, I don't know how to do it, but I'll give it a try is good. And it depends on the sort of boss you have, obviously. I do think for a lot of people, a lot of employers, they take it the wrong way, as in the sense that like, oh, this guy's trying to make an excuse for why it's going to be a bad job, or even, further reinforce, oh, this person's incompetent. He doesn't even know how to work Excel. Like, what are you talking about? Like, that's, further reinforce things that this person's incompetent, and just perpetuate that idea that I'm not happy with this person's work overall. So whereas if you just cut it as, yep, I'll do it, and then you suck it up and get it done, I feel like that the workforce we have is tailored towards fake it till you make it. If you're under someone of authority, kind of thing. So for me, what I think is morally reprehensible is I don't think if you're in a position of authority that it's okay to not say I don't know and lie about what you do know, because you're the person who's meant to know. So if someone underneath you comes up and says, hey, can you teach me how to do this? If your first thing isn't, look, I've got no idea, but here's what I usually do anyway. Here's how I try and go about it. Because at this point we're on the same footing. We both got no idea. I think that's fine of doing that. Or if you are underneath them and they say, hey, can you do this? I think it is morally justifiable to say yes, just because if you do have potential fear that you'll be seen as being incompetent or whatever it is.
I both disagree and agree with you. So I do agree that absolutely our current society is tailored towards the yes man. Just get it done. Don't really care how it's done. Just has to be done, and you putting in the effort. And then saying, I don't know, but I'll give it a shot, often instills that unsecure feeling of, okay, well, I have no idea if this guy's going to even be able to do it. Like the other guy said he will do it for me, and he's sometimes reliable, but at least he's giving it a go and he's not complaining about it. That's a whole nother thing for me to think about, is if someone says, I don't know, that's of course questioning. And then you've got everyone else in the team who will be saying, or a very similar situation of, yes, I can get it done. I have no idea how to do it, but give it a crack anyways. too much to think about, too much to worry about from a management perspective. So it is really
Exactly.
tailored towards that.
Exactly.
But personally, if I, of course, through R.E.A.L, if we had ongoing in the future some additional practitioners and they're like, hey, I don't know how to do this. I'm like, okay, cool. Is it, I don't know, I don't want to? Or is it, I don't know, can you help me and can we work through this really quickly? Or is it a situation of, I don't know, give me 5 minutes and I can come back to you and I can see if I can do it or not?
Yeah, exactly. Yeah, I think but obviously every single manager can handle different loads. What I feel like is the case with a significant majority of people who are managing people is that they already feel like they're so overwhelmed managing this person, this problem, that if you can, they really value someone who will just suck it up, say, like, as you said, yes, like a yes man, just suck it up and say yes, despite not knowing exactly how to do it. And they'll stumble through, if they come up with a hurdle that they don't really know how to do, they'll figure it out themselves and they'll guess it through, estimate what they need to do here and there. And even if they don't do the best job, the manager's still going to value them, most likely value them, because it's like, wow, you gave me no grief at all. I didn't even need, I know I know how Matt works. I know when Matt says he can do something, I'm not going to hear from him for the next 24 hours. He's not going to be calling me up 4 times a day going, hey, I'm stuck on this thing. Can you help me through this? Can you help me through this? And I think most managers really value that. So that's why I feel like that. And it seems to be like he agrees well. Matt, this is officially a philosophy podcast.
I like philosophy. I think it's quite interesting. I know absolutely nothing about it, but I think I have quite a few philosophical thoughts with myself on a daily basis. I do agree with you, Max. I think that's, people are just looking for less of a headache. And when they ask for something, they're not expecting, most of the time, they're not expecting the perfect outcome. They're just expecting it to get mostly done to a sufficient level where it's acceptable. Mm-hmm. And then that's usually like the bare minimum that people go through. If it's not, of course, then you have a conversation, then you readdress it. But that's part of the, I guess, the gamble of setting someone to do a job is you have a certain success rate. And then, of course, that success rate comes with a level of capacity of how well it was done.
Yeah, most definitely. Most definitely. Okay, well, that was a really cool intro. Now I feel like we're at the point in the movie where the intro actually plays.
Yeah, welcome to the R.E.A.L Health and Nutrition podcast. We talk about real health, nutrition, sport performance, things along those lines. Max, today we're talking about why I hate the term holistic.
Yeah. So, we're going into it. I've actually thought about it a decent amount this week because we spoke about it last week, what we're going to speak about and all that. And you said I want to speak about holistic, my ideas of it. And I actually have the exact opposite point of view. I love the word holistic. So this is interesting because as someone who does call himself a holistic dietitian, which is you, and someone who doesn't call himself a holistic dietitian, we literally are the opposite in that you'd expect me would be the person who hates it. But anyway, away we go.
Yeah, spot on. So for people who don't know me, when I introduce myself to businesses, to individuals in the population, sometimes I go by Matt the dietitian, sports nutritionist, soon to be sport dietitian, Matt the holistic dietitian. It depends on what kind of situation we're approaching and what kind of context is needed. But overall, I use a very holistic approach. I often call myself holistic dietitian. I think it's on my majority of my LinkedIn profiles and whatever it is, the Facebook profiles and such. I quite like the term and the idea of holistic practice being, and I've got the definition. So characterized.
So I hate it when we do that, when we say we completely disagree and then 30 seconds in we actually realize we're the exact same.
Remember to check the link in the description or our website for our consultations. Back to it. You haven't let me finish yet, Max. I've got a whole rant to go through. So the definition of a holistic practitioner is characterized by the treatment of the whole person, taking into account mental and social factors rather than just the symptoms of an illness via the Oxford Dictionary. Mm-hmm. I think that pretty well describes the way I personally run my dietitian practice. I also factor in additional factors that go in. It's not just nutrition, it's other physical factors that happen as well. So if we've got a sore back, okay, is it the nutrition that's causing a sore back or is it a bulging disc? And then can we use nutrition to address that bulging disc situation? Or is it a situation where we just need that quick fix to get you into a space where it's not a problem anymore? And then we can continue from there, like, I don't know, an epidural injection or something along those lines. The term holistic practitioner, dietitian, naturopath, whatever you want to use as a prefix, can often come with expectations of, let's say, less than credible expectations.
Anti-science,
Yeah,
pseudoscience.
yeah. Not to chuck too much shit on naturopaths and health coaches and things like that, but it's often applied to individuals who do not have that university level qualification, or if they do have a qualification, they're not practicing in their field. So I very much appreciate a holistic approach, but in my approach, I very specifically outline my scope of practice, what I can and cannot do internally in terms of what can I apply. I can have a chat about exercise. I can express why exercise is so important. I can potentially work with you in terms of having a discussion on which specific exercises may benefit you. But that's where I draw the line for myself personally, because one, I'm not a personal trainer, although I would argue that I'm better than one. I'm not an exercise physiologist in the slightest. I'm not a physiotherapist. My area is health overall and nutrition. It's not your physical body, although that is a massive part of it. And then where I draw the line, I then refer on to another practitioner, health professional, or get you to do your own research in terms of defining what would be the best for yourself, and then how will we go about achieving the goal that we've set. But of course, with me acting as my part, and then the other practitioner or yourself doing another thing, acting as the other part. There's many different areas, and one person that can solve all the problems usually doesn't exist. I say usually because there's a very few exceptions, me included, and that's a joke. But it's very much an area of, you can't be an expert in everything, and people who say they are often charlatans.
Yeah, that's it. And I completely agree. And I think the first question and the most important question you should ask yourself when you see or are seeing someone who has the prefix holistic before their profession is this person going to be overstepping and working outside of their scope of practice? I'm not going to name any names. I have heard stories of so many disciplines that have overstepped their practice. And I know that lots of them use that word holistic, and they kind of have that banner of holistic to justify that allows me to work outside of my scope of practice. You know, for some reason, if you put the word holistic at the front of your profession, it almost means it's okay for you to start talking about, you know, when you're an osteo, start talking about nutrition and start talking about exercise regimens and all these different things that wouldn't be under the osteo banner. And for some reason, they feel justified of it just because they say they're holistic, and I do with the whole person. And now we're doing a psychology session, and I'm being a social worker for them, and all this kind of stuff. So I think that would be the best thing is to ask yourself and think to yourself, does holistic to this person mean that they're going to be working outside of their scope of practice? Because as you just said, the reality is that we have disciplines because you can't be an expert in everything. Holistic should mean that you're working with a team of people who are experts in their own individual fields, and then you're getting a holistic sphere. That's why when you're going to see hospitals, there's a multidisciplinary team of, you got your physio, you got your dietitian, you got your social worker, you got your psychologist, because one person can't do all of that. And that is a holistic approach. Literally, that's a holistic approach. You've got your, you know, social side covered with the social worker, your psychology with the psychologist, diet with the dietitian, and the, you know, physical side with the physio. It literally is holistic. And to think that there's people out there that believe they can do all of that as one person is silly. It's silly. And look, as you just said, not everyone who's holistic is like that, but I think a lot of them try to be.
Oh, absolutely. I find it's more common, the term holistic is more common with those practices which are not as, let's say, they don't have the piece of paper to back up their qualification. And I used to think that I can learn anything online, which you can. Absolutely. You can learn pretty much anything online. You can have a doctor's level of an education via using the information online, with the biggest but you can ever but. You don't have the confirmation that you can apply those skills to anybody's life in a practical sense. And you don't have the confirmation via the piece of paper to say that you actually know it to a level of standard that is appropriate and acceptable for the current social situation. So I think
just to add to that really quick, and I think it takes one to know one, in that Matt and I, when we are potentially going to be high. We've spoken about this a lot. This isn't on the menu, by the way. I don't know why I've spoken about it so much this podcast, but if we were to potentially hire people down the line and have them work for the R.E.A.L brand, we wouldn't care what qualifications they have, or especially around the nutrition sphere, which is what we know. We wouldn't care if they weren't dietitians or nutritionists. We care if they know, and it'd be the opposite. If they were a dietitian, they do nothing. There's no way we're gonna hire them. But it takes one to know one, right? Because we're very confident in our nutrition knowledge and we know a lot about nutrition, we are able to discern for ourselves as to whether we're going to be putting someone on or not. Whereas if you don't know it, if you don't know much about nutrition, you can't do that investigative vetting work to see whether someone actually knows.
Yeah, absolutely. I think in that whole process, going down that tangent a little bit, in that process, my main goal is to find out what you don't know. And if I find out that you're lying about something or you're pretending to know about something, it's, oh man, you're just out the door immediately. But if you have the balls to say, hey, I don't know that, but I can look into it and I can learn about that, then absolutely. I think that's a really underrated characteristic that we need to accept more of. But of course, it doesn't get views. It's not congratulated. Often it goes swept under the rug. People just want the yes man that think they know things. You got your Gary Brecker, your human biologist, who acts like he knows a lot of things and seems very confident with his answers and seems like he's intelligent, and he definitely is in some aspects, but it's very much almost a I don't know if it's a Dunning-Kruger effect or a lying to yourself situation where if you lie to yourself enough that you know enough things, I guess it is Dunning-Kruger, then you're more capable than the person next to you who potentially has more qualification, more experience, more literature understanding. It's a slippery slope that you go down with that area.
You know what's really interesting? I watched a video about how so many people know what the Dunning-Kruger effect is now. It's also been Dunning-Krugered. People.
Oh, I never thought about it like that. That's brilliant.
People butcher explaining what Dunning-Kruger is, which is Dunning-Kruger. It's so funny.
Oh, now you're making me think that I don't know what Dunning-Kruger is.
Yeah, I know. It's trippy. Yeah, a good thing is we actually do. We're not going to go over it now, but we actually do know what Dunning-Kruger is because when I was I read the study and it actually is exactly what we think it is. So
okay,
we don't need to worry.
There's a little bit of a confidence boost, or more so an appropriate level of confidence how that understanding.
But yeah, it is scary, right? Because I got trapped into it too. There was that my heart sank when I saw the video. I was like, oh fuck, not me. Because it's true. Like you hear it so many times and you're like, okay, well, I'm very familiar with this thing. You know, I don't need to actually look at it myself. Like I've heard it explained so many times. I've heard people talk about it so much, but we've never actually looked into it ourselves. And so there's that thing of that, holy shit, that's how easy it is to get into that position of that you just did it to yourself. You just Dunning-Krugered yourself with Dunning-Kruger, which is so ironic.
Absolutely.
But yeah, I think overall for me, when I look at the word holistic, I think it's only a positive thing. If you remove all the negative connotations that come with it, you know, potentially people who are more biased towards pseudoscience and not Western medicine practices, more, you know, those not scientific based practices and all those people that associate with the word holistic, if you just look at it raw without any biases, it's only a good thing. Would you agree with that?
Yeah, absolutely. If I was a dietitian and then you come to me for type 2 diabetes and we only have a conversation about carbohydrates, I'm doing a bad job. I'm not providing the answer that you're looking for. And if potentially we do come to a conclusion, it's not the conclusion that I will be comfortable giving, knowing what I do now. It's very much a situation of nutrition is not the only answer. And if you fall down the path of physical therapy is the only answer, or surgery is the only answer, or medication is the only answer, it's a very slippery slope. You get put down that pathway, you fall all the way to the bottom, Alice in Wonderland style, get to the end and you're like, okay, well now I'm stuck. Well, I've got like 20 billion pills and I'm doing so much physiotherapy that I'm not recovering appropriately, or I'm only seeing a naturopath and they give me so many supplements that I'm like swimming in them, but I can't get my food in. You get a very tricky situation where you may not get the outcome that you want and you may be worse off than you potentially are. I think we've definitely come a long way in terms of majority of health practitioners are quite holistic, but I think the main problem and why I hate the term so much, but of course it's a love-hate relationship because it's a beautiful idea, but I hate that it's kind of getting butchered in the sense that everyone thinks they're an expert in everything.
Yeah, it's been taken over.
Yeah, absolutely.
Yeah,
And I think
yeah,
that's leaning more and more. Sorry, I'll let you chat in a second, Max. Leaning more and more into the functional practitioner kind of pathway, which I think is very very sketchy and very potentially even more harmful than some other areas. Max,
yeah.
please take it away. What we
Well, look,
got to chat about?
I would just correct what you said there, because, and let me know if I'm wrong, but even if you gave, in my opinion, it wouldn't even be about only talking about carbohydrates with that type 2 diabetes patient. It would be, even if you gave them the best nutrition counseling session in the world, you literally, God looked down on you and said, yes, that's the best dietetic session I've ever seen in my life since the beginning of time. Even if you did that, it would still be bad if you didn't refer on to the appropriate sources for type 2 diabetes. Type 2 diabetes is massive. Of course, you're going to need to see someone like a psychologist or a social worker or someone to deal with the psychological impacts that come with being diagnosed with type 2 diabetes. It's a massive thing. Of course, you're going to need to see someone, maybe an exercise physiologist or a physiotherapist, or probably someone more toward like an exercise physiologist, to be honest, to prescribe exercises and get that person physically active and moving. So it wouldn't even necessarily be about if you conducted a poor nutrition assessment. Even if you did the best one in the world, if you didn't refer on, then that's not good enough, and that's not a holistic approach.
Yeah, absolutely. You're missing out on potentially so much more of the session. And if you don't act as your own screening tool, even if it's a basic screening tool where you're kind of just looking out for key red flags for each discipline, I think you're doing a disservice to the individual. And
Yeah.
exactly like you mentioned, with type 2 diabetes in particular, there's so many different varying factors. Not everyone needs a psychologist. Not everyone needs an
Yeah.
exercise physiologist. Potentially, it's mostly of a genetic factor with the type 2 diabetes, and it's literally just nutrition that needs to be addressed, or potentially the exact opposite, in that nutrition has very little impact for this individual, and it's mostly body composition that needs to be adjusted. It's a very tricky scenario where we need to be aware that disciplines exist for a reason, and we are experts in our own field with our own level of understanding, knowledge, expertise. I think GPs often get a lot of shit, like your general family doctor for your American viewers. They're often talked at, oh, they don't know anything. They just give me XYZ. They're just pill prescribers or things like that. GPs are amazing in the sense that they are the screening tool for the health industry. So they're there to ensure that you're getting the care that you need and what's appropriate for you. But it often comes with a level of inaccuracy in terms of you may not get the care that you need initially, a few different reasons for the current Australian healthcare system. And then people generally don't want the extended, long effort, a lot of strain and medical appointments, things like that. People just want the quick fix, including myself. I think everybody wants everything to be done immediately. If I have back pain, like extreme back pain, I want that to be resolved as quick as possible. Usually when someone says you need to go through extended amount of physical therapy to resolve this back pain, or surgery, it's a bit of a toss-up, because like, okay, is a surgery actually going to provide me that solution quicker, or am I going to have to do the physical therapy because that's going to provide me a better outcome in the long term? It's a way up for the individual, and often the GP or the surgeon or physical therapist, or a culmination of those situations, have to come to a conclusion that's best for the individual. Often people sway these kind of results in the sense that they want it as quick as possible, resulting in the pathway of a lot of GPs getting painted as the prescriber of medications, or just the prescriber of the referrer onto some additional practitioners. But I think that's a little bit unfair, because they're doing such an amazing job at screening and ensuring that you're getting the best care that you can get. But of course, having a balance of, is the medication going to aid in that situation, or is it kind of just going to mask some potential symptoms? Or if it applies, is the masking of symptoms all that you need? Do you actually need to resolve the issue, or is it resolvable in the first place?
Yeah, most definitely. And just really quickly, in case people got a bit triggered by what Matt said before, and I think this is a really good example of one of those small things where if you know a little bit of information, it can actually hinder you. I see it all day, every day in the nutrition sphere. Matt talked about how type 2 diabetes has a very significant genetic element to it, and it absolutely does. And I think where you could have been triggered if you didn't know a lot would have been, no, that's type, he's getting confused. That's type 1 diabetes.
Yes,
like, yeah. Also, reason being is that there's a lot of, just like any other disease out there, I think people might get a bit confused with type 2 diabetes. I know when I've had conversations with people, I've definitely noticed that, in the sense that because they see type 2 diabetes as, I think the stat is like 99% of it comes down to diet and exercise. just because that is a true statement in the sense that if the people that developed type 2 diabetes had more favorable foods and exercised more, they wouldn't have developed type 2 diabetes. It doesn't also mean there's a very significant genetic component to it. Exact same goes for like cancers and cholesterol levels and all that. These cancers and cholesterol is extremely genetically biased. That also doesn't negate the fact that if they had have eaten better, like, eaten different foods, they wouldn't have the cholesterol levels or cancer risks that they do have. And same goes, I'm really not making sense on this one. Point being,
I thought you did that quite well, Max. Yeah.
Okay, thank you. There's certain populations. So with type 2 diabetes, and Matthew, correct me here, but I'm pretty sure your Southeast Asian populations, Malaysian, Filipino populations, Polynesian populations as well, very susceptible to type 2 diabetes. And what I mean by that is that different other populations around the world which are less susceptible to destruction of the pancreatic beta cells, which is what causes type 2 diabetes, or insulin resistance in general. There's going to, if you had two people that did the exact same amount of exercise, exact same diet, the people in those, Filipino, Malaysian, Polynesian countries, they're just going to develop type 2 diabetes at such a significantly higher rate than other populations around the world, whether it's, European countries or, whatever it is kind of thing. And that's not down to, the Filipinos are unhealthy or the Malaysians are unhealthier. It's just because they have a high susceptibility of it. And there's an important distinction to make there.
Yeah, I completely agree. So with that statement, I think it perfectly summarized my view on a lot of health aspects, in that genetics loads the gun, your lifestyle pulls the trigger.
So I really like what you said about multiplier. I was thinking about that the other day. I really like the multiplier thing because I think it puts it really well in the sense that, because you brought it up on our previous podcast, the genetics is the multiplier, right? And if you've got a high number that's starting out with the multiplier and you times it by other high numbers, fucking hell, it's insane, right? But if you've got a low number, if your genetics are low, your susceptibility, I think lung cancer was the example we had last time, your susceptibility for lung cancer is really low. And you do things that are even high, smoking, high pollutant areas, etc. Maybe even have a job that is going to be increase your chance of lung cancer. If that initial number is low, it's pretty hard to make it an astronomically high number because that number that you started with is so low. So I really like that analogy you gave.
It's very tricky to put that number on things.
Yeah, of course. Yeah,
it's,
for sure.
It's a really good idea in theory and having that discussion. But if I was to say, hey, Matt, like, you put a gun to my head, you need to put a number on the initial multiplier of your chance of lung disease or cancer. It's like, bro, I'm not a geneticist. I have absolutely no clue. But what we can look at is your family history. Do you have a family history of lung cancer? Do you have a family history of type 2 diabetes? Is that family history potentially skewed by certain societal factors or body composition factors? Or is it purely a genetic factor? Or like, do you get type 2 diabetes when you have a BMI of, let's say 23? I would say that's mostly going to be a genetic oriented factor. But of course, there's so many scenarios and factors that go into that situation of, okay, we need to look at this holistically and establish what can we do to address the situation. Is it appropriate with the level of interventions that I would recommend, or is it requiring some additional health practitioners and or medical services that can address the situation as a whole?
Yeah. I really like the idea of you continuing to use the word holistic. I think it's a good word, and I think the definition of it is really important. I think no matter how much it's hijacked by other people that we disagree with or don't find common ground with, we should still continue to use it because of what the word actually means and what the definition of the word actually means, which is something we agree with and something is very important to us. So I really would encourage you to continue using the word holistic. Guys, quick ad break. We are currently taking on clients. Click the first link in the description to explore more. Back to it.
Of course. I think I will definitely continue to use it moving forward. Something I've noticed a little bit more.
I'll never use it.
Oh, that's fine, Max. That's not a problem at all. We know that you're the sport-oriented dietitian. You'd be the sport or the fitness dietitian if that wasn't already taken by now. In terms of other movements, I've noticed in recent years, we've moved away from individuals calling themselves holistic practitioner and holistic blah, blah, blah to functional. And that, it's a new word. it's fancy, it's
Yeah,
exciting.
yeah.
Functional is,
Bro.
oh, I live my life functionally. I train functionally. Oh, that's amazing. It's like, shut the fuck up. What the fuck are you talking about? Get out of here.
Yeah, yeah.
Functional, overall, it's an unprotected title. If you call yourself a holistic health practitioner, unless you have a level of qualification behind you, there's no guarantee that you're going to get the medical experience and treatment that you're expecting. Same goes for functional practitioner or functional health coach or something similar. Unless there's a medical backing or some level of qualifications behind it which has some support and evidence base behind it, I'd be very surprised if there's any consistency between different practitioners. There's no doubt amazing holistic practitioners and functional dietitians, functional doctors, absolutely they're out there. But I think the consistency and the variability between those individuals can often be extreme. And you're luck of the draw. If you go to your random corner and like, hey, you're a functional doctor, what does that mean? I think you get different answers depending on who you talk to, and their understanding of what functional medicine is may be a little bit skewed. As far as I'm aware, and I'm not aware in the slightest, I think it's more of a synonym situation where holistic and functional often get painted in the same box. It's a bit tricky, but I think it's them trying to move away from the bad connotation that holistic has and more to a new, exciting, fun, fresh, let's say qualified word being functional. It's like I train functionally. What does that mean?
Yeah.
How are you training functionally? Are you going to do your Romanian stand-ups or whatever they're called on a regular basis? Like, how does that apply to your daily life? Are you holding something above your head consistently? It's a tricky situation. So please do your research. If you feel like you're going to see a functional practitioner because that aligns with your views, then absolutely go ahead. Please do that. But be aware that often they are, let's say, they're unprotected titles. The individuals who practice that level of therapy, I'll use the word therapy because I'm not sure if it's medicine or not. The individuals who use the term to describe their therapy practice may not be able to give you the experience that you're looking for. And if they do give you an experience, you may not get the outcomes that you are originally seeing that individual for.
Yeah. Oh, and equally with the same extent is it, I encourage people to have a look at how much placebo matters too. And how much, if you truly believe something, how much it matters too. If you truly believe when you go to that Reiki instructor, you're going to be healed, how much that really, really matters, because it does matter a lot. And if, like, at the end of the day, it doesn't matter. Man, I don't care. If you go to the Reiki person and if you feel amazing after the Reiki, that's great. That's great. You've been in a significant pain. You've had knee pain for years. Physios couldn't fix you. Osteos couldn't fix you. You've gone to doctors, they couldn't fix you. And you go to the Reiki person and truly believe the Reiki person was going to fix you, and they did. Awesome. That is so good. That's so good. I think it's just worth having a look at how powerful the mind is and how powerful placebo is, because it is actually insanely powerful.
Absolutely, without a doubt. I have recently did a supplement post on Instagram in terms of what supplements you should take when you go to the supplement store. Should you be using XYZ? How do
that
you
was an amazing
evaluate?
post, by the way.
Thank you. I appreciate that. Go check it out. It's quite an interesting one. But what I left out of that is, and I didn't have enough time for it in the 60 seconds, is how do you determine if the outcome, if the supplement's actually doing something? Like, we can, even for myself, I'm biased in my own perception of things. I started supplementing with vitamin D. Yes, I was a little bit low. I felt significantly better, but that could have been a lot to placebo. I know the evidence supports my usage. There's pathways and biochemical blah, blah, blah above my pay grade, and definitely not a biochemist or pharmacist to know the in-depth yes, no, XYZ of all the different pathways. But I think it's important to establish that if we're taking a supplement, do we know if it's going to work? How consistently does it work? How much of an impact is it going to have? And just because it's statistically significant doesn't mean it's clinically applicable or clinically significant. So if I was to go down to the supplement store and choose you from the supplement aisle and then take them all at once, and I'm feeling amazing, I'm feeling better, I have absolutely no idea what any of them have done, but I'm feeling better. So is that a bad thing? It's a tricky scenario because as long as it's, from my perspective, as long as it's not causing too much harm to your wallet, it's not ruining any other aspects of your life, and it's not limiting your ability to get additional therapy that potentially could put you in a better position overall, then I think
And it's
there's
not
not too
addictive.
much of a problem. Yeah, of course.
Yep.
Yeah. So it's a bit of a tricky one, but again, exactly like you said, Max, if the Reiki practitioner, whatever you want to call them, has aided you in that situation, I'm going to shut up because I think that's amazing. All my goal is for you to get to the position that you want, for you to achieve your goals. If that requires some level of, let's say, pseudoscience or some level of alternative medicine, which I may not find the evidence in, but you come to me like, hey, Matt, I did XYZ, I did dry needling, then I did cupping, and then I did this and that, and my lower back feels amazing. I feel like I'm a whole new person. I'm going to celebrate you with you. I'm doing a little dance in my office for you. That's amazing. Full stop. End of story. As long as it's not requiring a sacrifice in some other area that's outweighing potentially the benefits that you're receiving.
Yeah, 100%. 100%. Look, yeah, completely agree, man. Completely agree. I'm pretty sure by the time this podcast comes out, I would have just posted my second blog. And what the blog's going to be on, just for a little bit of a review, because I think it'd be nice to expand on our blogs moving forward, Matt. I think that'd be cool to talk about. I'm going to be talking about, I was speaking to a lady last weekend, and she was, I've heard this comment a lot, and I only kind of processed for me properly when I was speaking to her. I didn't push back in any way, because I don't like pushing back. Again, people who aren't qualified or aren't in positions of authority, I don't like pushing back against their ideas, because it sets up a really weird precedence between me and them, especially if I'm coming from a position of authority and of someone who's meant to know things. It feels a little bit awkward for me to be shutting down all their ideas all the time. Whereas if I know if I'm speaking to a dietitian or someone that is a nutritionist or someone that sees clients and they spout shit ideas, I will 100% shut them down 100% of the time, because I expect better. And I don't care whether I know them a lot or I don't know them at all. I will always shut them down, because that is their job, and the expectation is very high. What she was talking about was she was saying one of these things which is I think tries to discredit nutrition science a lot, but I think it does it's a really poor argument. And it's this whole idea that there's no diet for everyone. And it's something that, do you hear that said a lot, Matt?
I've heard it. I've even said it before, but I think there's a lot of nuance. It's like the jack of all trades comment, where it's, you're a jack of all trades. But then, of course, we're missing out on the entire rest of that saying, which is, I've completely butchered it because I'm master of none. But of course, there's an extended version of, I'm going to look that up in a second. But I think
while he's doing that, I'll just kind of just go through, just because for me, I think it's a really, really bad attempt to try and discredit nutrition science, because obviously there's no diet for everyone, but it just matters how closely you zoom in or zoom out for me. I think that's the biggest kind of comeback and counter argument that I could put up to that. And the point being is that, of course, there's no diet for everyone. And if you zoom in really, really far, of course, you're not going to prescribe chicken and rice and broccoli for every single person. That's just stupid. But you wouldn't do that. You wouldn't prescribe a diet for everyone. You prescribe ideas and philosophies and ways of thinking for everyone. Yeah, exactly. You just prescribe ideas for what would be a good amount of macros for a certain meal, percentage of macros, what would be a good amount of, how a plate should look like in terms of what foods you should be choosing, what food groups you should be choosing. You don't prescribe specific foods. That's just such a stupid way of thinking. That's how nutrition science is run. And I think it's just such a poor attempt at discrediting nutrition science, and that, because there's no diet for everyone, then then that justifies my reasoning for going on carnivore. It's like, no, that's not how it works.
I can't believe you've heard that. That's hilarious.
That's literally what she was saying. She's like, there's no diet for them. There's just so many diets work for so many different people. It's like, yeah, because there's so many foods. Chicken is now our only source of protein. So yeah, anyway, so I'll let you keep going with the other point.
No, absolutely. I completely agree. I wanted to build on top of that. So jack of trades, master of none, though oftentimes better than the master of one, I think is the full saying. And it's important to acknowledge that just because we want to believe a certain part and it becomes more, let's say, commonplace in society, we're completely omitting and not remembering the rest of that entire scenario, which I think can be quite dangerous. And I completely agree with the nutritionist and dietitian situation. For those who are unaware, in Australia, a nutritionist is an unprotected title. Anybody can call themselves a nutritionist. There's no legal action that can be put against you. Even Nutrition Society of Australia has a big trouble in maintaining the credibility of nutritionists. You have people going from, I think it's like an evergreen college or something like that, getting a nutritionist degree in like 2 weeks versus people who walk out of PT school and get a nutritionist degree by they write nutritionist on a piece of paper and they're like, bro, I'm a nutritionist, no problems at all, versus dietitian, where you have to spend 3 years doing a bachelor plus 2 years doing a master's, including 100 and something days of clinical placements in a clinical setting. And we're all
which is like 1,000 hours. So
yeah, absolutely.
Yeah.
All kind of grouped into the same situation. And I hate to throw people under the bus too much, but I was at a networking event recently and there was a nutritionist in this situation, and it was nice to meet someone in a similar field. But there happened to be a multi-level marketing scheme individual trying to promote her bullshit. And I get messages almost on a weekly basis of, hey, come try my Herbalife thing, and then it'll give you $100,000 in 100 days or whatever it is. I'm like, I see these things from a mile away. I can smell them as soon as they enter the room. Absolutely shocking. But this individual was buying into it. And I'm like, what is going on? People don't understand the difference between nutritionist and dietitian. Because we're grouped into the same level of kind of, that's the nutrition people, that's the people that talk about diet. The level of credibility when a nutritionist says something stupid, or even a dietitian says something stupid, brings down the level of credibility of everyone in that scenario. So I think it's very important that we hold ourselves accountable and others accountable in the field to ensure our credibility maintains as high as possible. And of course, being aware that you don't need to know everything. It's important that there is a difference between nutritionists and dietitians. Nutritionists are very important in promoting general health practices that are really good. Dietitians are more so for specific medical nutrition therapy, management of specific therapies, application of specific foods into your lifestyle that can address certain areas and achieve certain goals. They both have their place. I think they're very important as a separate entity, and getting them mixed up and one pretending to be the other can be quite messy and often paints a bad picture for the practice of both nutritionists and dietitians.
Yeah, 100%. And look, for me, I'd definitely say this I'd say this more aggressively in a private platform rather than a public platform. But honestly, dietitians are just way superior to nutritionists overall. Like, there's just the reality of things. Every single dietitian is a nutritionist. That's what comes with being a dietitian. It's just something you have to do, really. It's just, for me, it's just way superior.
I would say so, majority of cases. I think there are definitely nutritionists that are better than dietitians, and the same sense where there's dietitians that are a lot better than nutritionists. I think a lot depends on clinical application, justifiable of their level of evidence understanding, their biases in terms of what they're biased to and what they're biased against. I think most dietitians are pretty much on the same field. They're usually not biased towards any one level of literature, but of course there's small individualities. Sure. I think that the biggest will be the weight-centric versus weight inclusive approaches, which we can have a conversation about in the future.
Yeah, no, for sure. Oh, look, most definitely. And there's people I know, but look, 100%, man. And that's why I really don't care about pieces of paper at all, especially in the field of nutrition. Look, for me, what I had this explained to me, I think it was a couple of years ago, in that what do degrees offer people? And degrees offer essentially the layman, so fields that I don't know about. So like, let's say there was a degree in mechanics, right? I know nothing about cars. There isn't a degree in mechanics, but let's say there was, a degree and a master's. And I went to someone who had, because I know nothing about cars, and I went to a mechanic who had his master's in mechanicking. And then I know for myself, I can be rest assured, because at least this person knows a base level of knowledge that's enabled him to pass his master's of mechanicking. So I can feel rest assured that, okay, at least this guy knows what he's doing to some extent. He might not be the top, but he's not going to be god awful, right? And that's kind of like the same as what degrees offer for everyone. For the layman that knows nothing about nothing, I can't vet him out. I can't ask, hey man, like, what's a tire, bro? Like, what's a rim? And all sort of shit, because I'm never going to be able to vet him out to see whether they actually know stuff about cars. And that's what degrees offer. Degrees offer people who know nothing about nutrition. They know a dietitian, at least there's going to be a minimum knowledge barrier that they've overcome to be able to see that qualification. But this is what I mean by I don't care about piece of paper, because, our friend Will, he knows more than most of the dietitians, I think, that would have graduated with us, in my opinion. And he's not a dietitian. He dropped out at the end of nutrition. I've got people that I know in my life that know just as much about nutrition as a lot of the people that would have graduated with us. And just because they don't have the piece of paper to back it up doesn't mean that they're any less credible.
Yeah, absolutely. And I think it's important to note that. Sorry, please go on, Max.
No, but just on average, it's like same as like BMI. It's like, of course there's going to be people I know that have a high BMI with also healthy, but I think that's the exception to the rule. On the average, dietitians are just more knowledgeable, better, better understand the science, everything compared to nutritionists on average. Same as like BMI of 30 is going to be typically have worse health outcomes to people with BMI of 22.
Of course, absolutely. The worst doctor in the room that graduates alongside the other doctors is still a doctor.
Yeah.
There's going to be variables that are at play, but I think it's important that that doctor is still having a qualification of, okay, he's gone through a shit ton of school, shit ton of practical application and clinical placements. He knows at least a very stable baseline of general health practices that he can go and then further on specialize into, whether he becomes a GP or a surgeon or a interventional radiologist or a variable areas, in the same sense that dietitians don't really stop. A lot of them end up going into PhDs and then honors projects and really delving into their niche, in the same sense that a lot of individuals, nutritionists included, can really delve into sports science or gastrointestinal dysfunctions or something along those
public
lines.
Health.
Absolutely. And then people have different niches, but if you go into a dietitian full stop, they have a baseline knowledge of IBS, type 2 diabetes, osteoporosis, cystic fibrosis. You've got a whole range of situations where they need to have a baseline of, you can have a chat to them and they should be aware of at least the bare minimum level of stuff.
Exactly.
And then, of course, hoping that they have the confidence to say, I don't know, but I'll get back to you.
Yeah, exactly. Yeah. Look, it's literally just like a bare minimum. Just like I think the analogy would be doing high jump, in that every dietitian that qualified for us has been able to high jump at least 1 meter, and then some of them are going to take it longer. Some can take it further. They're going to keep doing professional development and expanding their knowledge, and they might be able to get up to a meter 10, a meter 20, a meter 30 kind of thing. But you still know, if you're seeing a dietitian, every single one of them has at least jumped over that bare minimum high jump.
Max, what an interesting conversation.
Yeah, it was cool. It was cool. Next week, we're going to have on I really hope there's at least some people that have stayed to listen to the end here. We're going to be getting on some guests for the podcast. We think it'd be a really nice change up and something we can put on. So we're going to be getting on a guest next week. I'm not sure when we'll actually publish it, but we will be publishing it at some point. And we'd love more. So if you are listening, it doesn't matter whether we know you, don't know you, we'd love to have more voices on, and we'd love to hear people's opinions and all that. So if you are interested, please feel free to reach out. We'll chuck in. Do we have our email address in the description, Matt?
We have our email address on our website in the contact form. That will be admin@realnutrition.com.au, admin@realnutrition.com.au, or just check out the website because it's pretty cool.
Yeah, check out the website. Shoot us a message through the website. Super easy. First link in the description. But yeah, we'd love to hear your thoughts. I'd like for this to be a really collaborative thing. Getting people to give their ideas on the blogs and just everything we got going. I'd really like to hear people's thoughts about it all.
Absolutely. Thanks, dudes.
See you guys.
Thank you so much for listening to the R.E.A.L Health and Nutrition podcast. The sponsor of today's show is you. You support the show by listening and using our services of dietitian consultations and performance coaching. We offer in-depth one-on-one consultations to help you achieve your health and performance goals. Any random bloke online can give you a generic meal plan, where we here at R.E.A.L work collaboratively with you to reach your goals, making you feel heard and including you in your journey's planning. Our service offers tailored advice and can accompany meal plans and/or realistic nutrition strategies, which can be booked via our website, www.recoveryexerciseandlifestyle.com. That's www.recoveryexerciseandlifestyle.com. Just a quick disclaimer, this podcast is for education, information, and general entertainment purposes only, and does not constitute the practice of medical nutrition therapy or healthcare of any discipline. The content discussed in this podcast is not intended to be a substitute of professional medical advice, diagnosis, or treatment. Please review our terms of use via our website. Thank you so much, everyone. Have a great day.